Hi, I'm Morgan from the marketing team here at WellTalk. I'm joined today by the brilliant Dr. Chantal Reyna, a breast surgical oncologist. Dr. Reyna is not associated with WellTalk. So happy to have you with us here today, and the timing could not be more perfect as we approach Breast Cancer Awareness Month. We're certainly living in very uncertain times, right? You've all seen the headlines, and Dr. Reyna, you've seen this firsthand with people being afraid to come into the doctor's office to get treatments, but they're also afraid to come in and get screenings right now. So how does COVID play a role in a person's decision to get a mammogram this year and their experience while getting one?
Well, first of all, thank you for having me. I really enjoy any kind of education, patient education that we can be a part of. So I just thank you for this opportunity.
Of course.
And you are absolutely correct. As a breast surgical oncologist, I have had experience in seeing how COVID has affected both screening mammograms as well as diagnostic mammograms. What we've really noticed is that people are scared. They're scared to come to the hospital. And especially when all of this started happening in the beginning, that's where most of the COVID cases were. They were at the hospital. And so people really tried not to get there or go there, especially for things that they thought were elective, such as my screening mammogram. And so we did see a decline in the people who are getting screening mammograms. What's even worse is that we saw a decline in people who are getting their diagnostic, meaning that they had a breast problem, a lump or a mass, and they didn't want to come in to get that further workup because they were so scared to come to the hospital. And so it has been a really big push. Once we saw that, we said, we really need to get this access to people. We really need to try to make this as safe as possible. And so putting in precautions, social distancing, spreading out time appointments, all of those things have been in place.
You're really thinking about how to make them feel as comfortable and safe as possible, which is what we all really need right now, especially when it comes to these cancer screenings.
Absolutely.
So in terms of the outreach, what do you think are some barrier-breaking messages to get people to book a mammogram screening?
I think one of the biggest messages is that screening is key. Early detection is very essential. So the earlier you find things, the more options you have, better outcomes you have. And so the biggest message is that take precautions, be safe, but still get your mammogram.
So this one's kind of a three-parter. Okay. What regular and ongoing screenings do you recommend as a breast surgical oncologist? Okay. How often should people do them? And when should people have their baseline mammogram?
Okay, so I'm going to frame it kind of in time points. So as a breast surgical oncologist, I utilize the American Society of Breast Surgeons recommendations for screening. The first is that it's recommended that women at the age of 25 get a formal risk assessment. Now, that can be in conjunction with a well-woman exam, but what a formal risk assessment means is that you take any risk factors that you have, whether it's your age, the time of menarche, any oral contraceptives, family history, and you can put it into a calculator and it can tell you what is your lifetime risk of breast cancer. For anyone who's found to be an average risk, which is about 1 in 8, but less than about 12%, are recommended to start annual screening mammograms at the age of 40. Now, if you're found to have a higher risk than that when you go in for your risk assessment, those screening recommendations change based on what they find. So in general, if you are an average person and found to be at average risk, we recommend starting annual screening mammograms at the age of 40.
Good to know. It's very helpful. So if someone does come in for a mammogram and they find out that they do have a cancer diagnosis, do you recommend that they seek multiple opinions? What are the first things that they should consider doing when and if they have a cancer diagnosis?
One of the first things I'm going to say is take a deep breath. The next thing that most people do is at this point is get onto WebMD or Google, and I'm going to say that the internet is not always your friend. I think it's very good to get some information, but just realize that not all of that information pertains to you and that diagnosis. There's a lot of variety out there. There's a lot of different things out there. And so getting an idea is fine. Just don't get overwhelmed. That is part of what seeking an expert opinion is about, is to take all that information that you've come across and really bring it down and how it focuses on you and how it relates to this. Now, you asked about seeking medical opinions and multiple opinions. And I am someone who feels that it's a good option. One of the things I've noticed is that surgery is a trust, at least from my perspective. And so you might go to two different people, hear the same information, but you might just feel more comfortable with one or the other. And that's okay. We understand that we are not always the surgeon for people. I mean, you're going to be under anesthesia, or the patient's going to be under anesthesia. They need to be comfortable with what's going on there. And so from my standpoint, hearing as much information as possible from different people can actually help you understand it better. So I think it's very valid to seek multiple opinions. People don't, and that's fine. That means that you found the right person at the first time. But if you really think about it, and this is kind of how I look at it, is if we're all going on a journey together during this breast cancer journey, you're going to have a medical oncologist, a surgical oncologist. You might have a few people on your team to take care of you. And if you're going to be stuck in a car taking a long journey, you want to be happy with the people who are in your car. And so from that standpoint it might be good to figure out from different opinions who you want to take that journey with.
I couldn't agree more. It's all about feeling comfortable and not resorting to Dr. Google. So I completely agree.
Dr. Google and Dr. WebMD. I had a Crow resident who always said, WebMD is only right, 90 or 75% of the time, and I'm right, 90% of the time, or something like that.
Yeah. I'll always seek a professional medical opinion. That's definitely the way to go. You mentioned fellow, and that kind of brings me to my next question. Can you explain what the difference is between a fellowship-trained breast surgeon versus a general surgeon? What's the value for them?
That is a great question, and something that we are asked quite often. So a general surgeon has done an undergraduate degree, has done medical school, and has done 5 years of general surgery residency, in which they have learned to basically operate from head to toe. And I trained as a general surgeon as well. The difference is that for those who are general surgery trained, they can choose to do extra specialties so that they can focus in one aspect. And so a breast fellowship trained surgeon is a general surgeon or an OBGYN surgeon, someone who has decided to spend an extra year dedicating just to learn about breast cancer care. And part of that year is that you learn the medical oncology aspect of it. You learn about the radiation aspect of it. You learn about the radiology aspect of it, how to communicate, how to understand all of these things. And so fellowship trained just means that someone has said, I have the ability to operate in all parts, but I've chosen to focus and care for this particular aspect of it.
What message do you want hospitals to get across to people and vice versa in their service area about mammograms and breast health this year? And you kind of touched on it earlier about the different demographics, but should the messaging vary by demographic?
Biggest thing is that it's going to be about age and where you are in that. So early or younger age, if you have your risk assessment and you're found to be average, then you're pretty good, right? Until you need that first mammogram. When you are 40, 50, 60s, then that is when you still need to get your annual mammograms. In terms of messaging for hospitals, I think really what it is to make sure that your hospital is providing a safe place with social distancing, masking, spreading out some of the time frames so that there are minimal patients to keep as much safety as possible. And then relaying that to your primary care physicians, relaying that to the patients that we are taking these precautions to keep you safe and still providing you all the access that you need. I think the biggest message is that we need to have safe access to our breast care and breast awareness.
Definitely. Well, Dr. Reyna, you have certainly given us a lot to think about, and you've shared a lot of great information with us today. Thank you so much for your time. For more information on how WellTalk can help with your COVID messaging and mammogram campaigns, please reach out to us today. Thank you.
Thank you so much for having me.